Cystic fibrosis is a genetic disease that causes the mucus in the body to be abnormally thick and sticky, with lethal consequences. Dr. Elizabeth Tullis has been my doctor for over 20 years. She is a leading clinical researcher in the area of cystic fibrosis and heads the adult CF program at St. Michael's Hospital.
Well, the cause of CF we know is a defect in a gene called CFTR, or cystic fibrosis transmembrane conductance regulator. And that gene was discovered in Toronto in 1989 at the Hospital for Sick Children. And we know that this gene codes for or gives the instructions on how to make a salt channel, a pore or channel in the surface of the cells that transports chloride into and out of cells. And the regulation of salt affects the regulation of water. So the defect in this chloride channel leads to the secretions or mucus in the body being dehydrated or thicker than normal. And it's this thick, abnormal mucus that causes the consequences of CF on the organs like the digestive tract or the lungs.
In the 1960s, the parents of a child with cystic fibrosis were told their child would die before reaching age 4. By 1985, median survival had risen to about 20 years. By 2010, half of people with CF were living into their 40s and beyond. Incredible strides have been realized in a short window of time, and this was with only being able to treat the symptoms of CF. Imagine the possibilities when the underlying disease can be targeted. For people with a specific genetic mutation that 4% of the CF population carry, this could become their new reality.
Kalydeco is designed to keep CFTR protein channels at the cell surface open longer.
So there was a phase 3 trial of Kalydeco that was published in the fall of 2011. And this was a very exciting study because it was 1 year long, 48 weeks long. And it compared people who were on the study drug with people on placebo or a inactive substance. And in the course of the study period, people on Kalydeco had a very large improvement in their lung function. On average, an increase of 12% predicted increase in lung function. So for example, if your lung function was 50% predicted, you went up to 62% predicted in the period of the study. It also showed that people on the study drug had less chest infections in that time frame, were able to gain a few kilograms in weight, so a significant amount of weight. And interestingly, their sweat chloride tests reverted down towards normal. So that at the end of the study, if you had done their sweat chloride test on treatment, it would have looked virtually like somebody who, almost like somebody who didn't have cystic fibrosis.
Scientists are already taking what they've learned from Kalydeco and working towards a drug therapy that can be used for the majority of the CF population with different genetic mutations.
So Kalydeco is very exciting if you're in the 4% of people who have the G551D mutation. But in fact, 90% of people with CF in Canada carry either 1 or 2 copies of the Delta F508 mutation. And Kalydeco doesn't work on its own in that patient population. So, you know, it only gets really good when we can actually target the majority of people with CF. However, we've learned a lot from this research because we now know how to potentiate or open chloride channels. And there are studies going on looking at other small molecules that will work in people who have the Delta F508 mutation. And so these would be molecules that would help chaperone the protein to get to the surface of the cell in conjunction with molecules like Kalydeco that open the chloride channel. So there may not be one medication that will work for people with the Delta F508 mutation. It may require a combination of medications, but we're well on the way to understanding the process that will lead to therapies to help the vast majority of people with CF.
If my friends ask me to come out even just for a coffee after work, sometimes I can't. I always have to be on top of it.
Well, Kalydeco is not really a cure because I guess if you think of a cure, you think you make CF go away in the entire body. And some of the organs in the body, we can't reverse the damage that's seen. So for example, because the pancreas is already damaged almost before you're born, we're not going to be able to restore full pancreatic function. And if somebody with CF has diabetes, Kalydeco is not going to make the diabetes go away. However, it will improve lung function and sense of well-being, and it will reduce hospital admissions due to exacerbations. So it will certainly make a big impact on people's quality of life and life expectancy, but it isn't fixing all the problems with CF.
We're on the cusp of an exciting new frontier of science and treatment for CF. I believe in the day when people with CF won't have to live with pain, fear, and breathlessness. When having CF won't mean having to stay one step ahead of projected life expectancy. I believe that more tomorrows, better tomorrows, are within reach. With your help, we can grasp it. My Great Strides team, Shani Stompers, is committed to fighting CF to the end. We're ready to go for another exhilarating year. We're united, motivated, and energized. Please support us, and with your help, we'll realize our dream to stomp out CF for good.
It's never a good time to have CF, but if you're going to have CF, this is a really wonderful time because there is true hope and optimism for a different way of life and a different future for people with CF. So I feel very blessed to be looking after people with CF at a time when we can sort of give this wonderful news, as opposed to perhaps if I had been a doctor 40, 50 years ago when there really wasn't the hope that we can offer today.